Welcome to our last module on respiratory protection, where we discuss respirator care, cleaning, and storage. As always, we'd like to thank the following individuals and institutions. In this module, we'll focus on care, cleaning, and storage of reusable elastomeric respirators. Some of the slides in this module are very detailed, and you are welcome to pause the recording at any time to review the slides in more depth. We hope that by the end of this module, you'll be able to describe how to clean particulate filter cartridges, explain how often cleaning and disinfecting respirators is necessary, and list the steps for safely cleaning and disinfecting elastomeric respirators. Again, our focus will be on reusable elastomeric respirators with filters that are enclosed in cartridges, as you see here. The cartridges allow for wipe-down cleaning so that the filters can be reused also. Not all filters come in cartridges, but filters must be enclosed in cartridges to be cleaned and reusable. Healthcare facilities should not use other types of filters. The filters inside the cartridges must not become wet. Reusable respirators should be inspected for damage. These are the steps needed. We will discuss both cleaning, which is the removal of dirt, and disinfection, the removal of pathogens. Here are some general cleaning principles. An organized approach to cleaning respirators at the end of a shift is recommended. Here we compare the basic steps for cleaning the respirators after each patient encounter versus at the end of a healthcare worker's shift. Between patients, the respirator should be wiped down on the outside using cloth rag and bleach solution and allowed to air dry. At the end of a shift, cleaning should be more thorough, and cartridge filters should be removed. Again, particulate cartridge filters should be removed before the respirators are cleaned at the end of a shift. They can be wiped down with a dilute bleach solution. Never let them soak in water, since this will damage the filter inside. We recommend cleaning the elastomeric respirators in a centralized location at the end of the shift. This is a list of equipment needed. If there are a number of respirators that need to be cleaned, consider having 2 people, so that the first person washes, rinses, and places the respirator in dilute bleach solution. The second person takes the respirator from the dilute bleach solution and rinses and dries it with a clean pair of gloves, using clean tongs. If one person is cleaning, they will need to use clean gloves for these last steps for each respirator. Since there are over 20 steps for cleaning the respirators properly, it's important to understand the big picture. The detailed protocol is in your handout. Here are the major steps. Don PPE and remove the cartridges. Scrub the respirator gently in warm water and rinse. Use tongs to soak the respirator in dilute bleach for 2 minutes for COVID, or 10 minutes for TB. The tongs are used to keep the respirator under the solution. Don new gloves, or have person 2 use a clean pair of tongs to remove the respirators from the bleach solution and rinse. The first person here removes the original pair of tongs at this point and uses them for the next respirator. Air dry in a clean, non-contaminated area. If you can use a sink with running water to rinse after cleaning and disinfection, you will only need 2 buckets. If you do not have running water, you will need 4 buckets. If you use the sink to rinse after cleaning, remember to wipe down the faucet handles. If the exposure is to tuberculosis, increase the concentration of bleach and the amount of time in the solution, as shown. Now let's talk about the detailed cleaning protocol. You can also follow along with the handout. Place the bag with the contaminated respirator mask near the cleaning area. Place a towel and lay tongs on top. Place a second towel nearby. Prepare 4 buckets, each with 2 gallons or 7.5 liters, with fresh warm water, or 2 buckets of fresh warm water if there is running water available. Do not use boiling or hot water. Don PPE. Pour 30 cc's or 1 ounce of dishwashing liquid into bucket 1. Pour 30 cc's or 1 ounce of hypochlorite household bleach in bucket 3. Remove the respirator and place it on top of the bag. Remove the filter cartridges by unscrewing or turning them to the left. Do not remove the valves because they are easy to lose. Wipe cartridge filters with cloth wrung from dilute bleach solution and place them in the clean bin. Without removing the straps, immerse the mask in the soapy water of bucket 1. Gently scrub the respirator with a brush and soapy water on the inside of the mask to avoid damaging the valves. Do not brush the eye lenses for full face piece elastomeric respirators. Rinse in fresh warm water. Running water is better than immersion if available. Thorough rinsing is important to keep detergents or disinfectants from drying on the respirator. Discard the biohazard bag. Then, for disinfection, place the rinsed mask face up into bleach disinfecting solution in bucket 3. Submerge the mask completely into the solution. Then, while the mask is submerged, use the tongs to turn the mask over until it is face down. Clip the mask with tongs and leave submerged for 2 minutes. After the 2-minute immersion, either change gloves and remove the respirator with a fresh pair of tongs, or have the second person, wearing full PPE, remove the respirator with a fresh pair of tongs. Next, rinse the mask completely in bucket 4 or in running water. Thorough rinsing is important to keep detergents or disinfectants from drying on the respirator. Place the respirator on a clean towel near the clean bin. Dry with a clean cloth or allow to air dry in a non-contaminated environment. Do not dry with heaters or in sunlight. When dry, reassemble the mask and filters. Check the integrity of the respirator and store in a plastic bag. After you have cleaned about 10 respirators, you can empty and rinse the buckets and clean the sink area with bleached cloth. Be sure to wipe the faucet handles with the bleached cloth as well. Then you can remove your PPE and perform hand hygiene. After cleaning, respirators should be stored away from the contaminated areas in a sealed container or bag. In summary, cleaning and disinfecting respirators at the end of each use is needed to remove microbial agents. When cleaning respirators after shifts, PPE must be worn. The cartridges must be removed. Only the respirator is fully submerged and scrubbed in water. The respirator is disinfected with the bleach solution and then rinsed and dried. This module includes a handout, and here are some additional training videos. Thank you for watching.